Welcome everybody. So today I'm going to talk to you about some specific drugs. Before we do that though, I want to talk to you about bioavailability. The idea that, you take a certain compound, maybe it's administered orally for example, and you swallow this, and then it gets digested in your stomach, and then only a portion of that drug will actually reach the target. And so depending on what you're trying to do, do you need the drug to be extremely fast acting? Do you need the drug, to get to a certain part of your body? That will really determine how you administer it, and that is based on how much of it reaches its final target. So, if I take a drug orally, for example, it could be degraded in the stomach before it ever reaches what it's supposed to. If I take a drug intravenously, it's immediately brought into my bloodstream and has a much better chance of reaching the target. If I have something that is administered, like subcutaneously, it may, reach that tissue in that area first and then diffuse out naturally through my body. So bioavailability, it greatly affects how active a drug is, how potent it is, how toxic it is, how effective it is, even sometimes how addictive it is. So keep in mind bioavailability, and when we talk about drugs, we'll keep coming back to this idea. Now the first drug that I want to talk to you about is aspirin. And aspirin is this acetylsalicylic acid right here. And we're actually going to synthesize this in class. We're going to do an esterification, and we're going to make acetylsalicylic acid as a product. The thing is that we have a hard time purifying it, a hard time actually making it. And when they do this industrially, they'll generally use this alternative synthetic route down here. That uses this ethanoyl chloride and a base catalyst, and they show that down here. And here's my aspirin again. But when we do it, we'll do it through esterification. And one of the things that we really want to test for is how pure the aspirin is, and we'll talk about that. And when we do the lab, we'll try and test its purity to see how pure it is. So let's talk about some details about aspirin. So interestingly, aspirin is one of those many types of drugs that actually comes originally from a natural source. That natural source is willow bark. And what you'll see is that you'll hear about these types of medicinal cures that have their basis in nature, like somebody like isolates a plant, or will chew on a certain leaf or something that will help cure an ailment, and they'll be like, oh well, it's just like some kind of it's not real. It turns out that a lot of pharmaceutical agents come from natural sources, and aspirin is a good example of that. Aspirin's considered a mild analgesic, so it's not a narcotic. It is not going to have an addictive sort of property to it. Nobody's getting addicted to aspirin. And it's part of this class of drugs called a NSAID, a non-steroidal anti-inflammatory drug. And that is abbreviated NSAID. Aspirin is generally used to relieve pain and fever. It reduces inflammation, it reduces cell damage, and it does this by generally inhibiting to an enzyme called cyclooxygenase. And these cyclooxygenases, these are proteins that will actually cause the body to respond to some kind of, assault. It's some sort of inflammatory response to some kind of assault on the body. And if we can inhibit these enzymes, we can inhibit that response. So a lot of times you'll get a fever because your body's trying to fight off some kind of foreign agent. But aspirin actually will inhibit that response. The thing is that although you have a fever, and that is your body trying to work against an agent, that has other issues that can damage your body in the process. So by taking this drug, you are inhibiting that response. So when you have fever, swelling, when you have pain, you want to try and, stop that. And so the way that you can do that, the way that you can stop that, is by taking something like aspirin. Now, on the market, there's other types of drugs that are doing the same thing as aspirin. Um, there, is Tylenol, which is known as acetaminophen. There is ibuprofen, which is Advil. And so these other drugs, they are the same type of idea. They're inhibiting these pain impulses, but their mode of action is slightly different. With aspirin, people actually use it in other, for other things as well. One thing about aspirin is that it's a really effective blood thinner. And so some adults will actually take baby aspirin, which is a much lower dosage of aspirin, and they'll do this, and this is actually a really effective way to prevent heart attack. Unfortunately, though, this has a side effect. And aspirin has a really acidic property to it. And when you take aspirin, it can actually cause ulcers in your stomach. And that could be a big issue. And so there's that side effect of taking the aspirin to prevent heart attack as a blood thinner. But aspirin's a really effective blood thinner. If you take it with a glass of milk, generally that will prevent that ulcer forming property of it. Okay, how available is aspirin? How bioavailable is aspirin? And so the thing is that you want to try and make this more available to your system. And one way to do that is to change its form really slightly. Make it an ionic form over here. So take away this H on that carboxylic acid group and make it a salt form. And this will help to increase its solubility, and that will make it much more bioavailable, which is important. Now, one thing that's really important for any drug is getting a pure form of it. We don't want to contaminate it with other drugs or other byproducts that might be toxic. And so this is the IR spectrum of pure aspirin. And in the lab, we don't have an IR spec. If we wanted to test for purity of acid, we would do things like find its melting point, which I believe is around 160 degrees. And we can also do another test with iron ions. And if it changes color, then we know that it's not pure. And you're going to see, like, even when we do this, it'll change this purple color because it's not pure. So I just want to end today with talking about one other class of drug and introducing it to you, and that is the penicillin group. And this is one of the original antibiotics. And again, look at what we have here. We have this situation where this was isolated from a natural source. And where was it isolated from? It was isolated by Alexander Fleming from a mold. And so, like, they isolated this particular agent from this mold, and then they found out that it was a great antibiotic. Penicillin really changed the world in which we live in. The discovery of this antibiotic that now is able and is the most widely used antibiotic that there is, and all the other forms that go along with it. There's other types of penicillins. They really are the most widely used antibiotic, and they've changed our lives. They've changed our lives because they have made it so that we do not have to deal with the same kind of bacterial infections and be worried about dying from them. So the structure of a penicillin, it contains this beta-lactam ring. And what does that look like? Well, here's the beta-lactam ring right down here. This beta-lactam ring, we'll see why it's important, but that's what I'm talking about with beta-lactam. If you look at those angles in that beta-lactam ring, they're at 90 degrees to each other. And this increases the strain of the bonds and the reactivity. Now, what does this actual penicillin do? Well, what it does is it will bind irreversibly, meaning it cannot be let go. Once it binds forever to this enzyme called transpeptidase. And that actually prevents the bacteria from making the cell walls, which are essential for its structure. And so now the bacteria will die. They'll be more permeable to water and they will die. Now this is selective to bacteria. As humans, we don't have cell walls, so we're not going to be, affected by the penicillin. But any sort of antibiotic that we take inside us, like in our stomachs, we have a natural bacterial flora. They are affected by things like penicillin. And a lot of times, one of the side effects of taking antibiotics happens to be that we would get diarrhea from that, or possible yeast infections, because the good bacteria in our stomachs keep that yeast in check. So you should have an idea of what the structure of the penicillin looks like. This side chain right here is really important because we can alter that, and this is rational drug design. The idea that we can take away that R, if it's just a hydrogen, and add other things and make other antibiotics that are part of the same penicillin family: amoxicillin, ampicillin, benzylpenicillin, which is penicillin G. And the idea that we can create new penicillins that are specific for different types of bacteria is really very, very powerful. Now, we talked a little bit about this in class, multi-drug resistance, and this is where you have this resistance of bacteria from the widespread use of penicillin. The idea that people are using penicillin like candy almost. And they are taking this and they are using it, so that, it's not necessary. And people may either use the penicillin carelessly, where they stop using it prematurely, or the bacteria start to become resistant to it as it is more widely used. So there's actually an enzyme that the bacteria are producing. It's called penicillinase. And it will actually be able to break down penicillin and make these bacteria resistant to the penicillin. Now, because of this, you will get these bacteria that have this penicillinase, and they will actually be able to, increase their population. And next time you get an infection, if it's a bacteria that has this penicillinase, then it won't be killed by the penicillin, and the penicillin will be ineffective at killing it. Now, we're seeing more and more of this multi-drug resistance. We need to be able to, try and come up with a way to combat this. And so here's just a little overview of what you can do. First of all, you can give a patient more than one antibiotic at a time. That sometimes helps. And you'll see this also when we do antiviral medications as well later on. You could make sure that the patients will take the drug for the full amount of time, the full course. It's called compliance. The patient needs to be compliant. They need to take the antibiotic for the full course. They can't just stop in the middle once they feel better. You could hold back on the prescription of antibiotics. Don't give it so often. This will help for the patients who, might have a viral infection instead of a bacterial infection. And then only prescribe when absolutely necessary, and also develop new antibiotics. And this is really where people are trying to focus, because it's hard to control a patient's compliance. It's hard to tell a doctor when to give an antibiotic and not. The best bet that we have is to develop new classes of antibiotics, new antibiotics that work through different ways. And if you start researching antibiotic classes, you'll see some of them work by inhibiting the DNA machinery, the reproduction of the DNA. Some of them work through the cell wall like penicillin does. Some of them work by inhibiting other enzymes. The more courses of action we have, the better chance we have of stopping bacterial infections. All right, thanks so much for watching.